Dr. Marks, welcome to the podcast.
Thanks for having me, Doug.
You're welcome. And I kind of would love to just get right into it because I know that you specialize in talking about all things mental health. And right now we're in a mental health epidemic, and people right now are struggling a lot. And specifically, I've seen with anxiety. From your perspective, why are so many people feeling so anxious right now?
I think it's a lot of different factors. One is a sign of the times, with all of the, probably beginning with the pandemic. I think that set a lot of people back and added a lot of stressors that we didn't have before the pandemic. But I also think there's just an increase in awareness. Probably 10 years ago, certainly before I started producing mental health content on YouTube, it was still very taboo to talk about anything mental, whether it be depression or anxiety, which are the two more common issues that people have. It wasn't as accepted to talk about it. But now with YouTube, TikTok especially, Instagram as well, it's become a lot more in vogue even to consider yourself vulnerable and enlightened, to be able to talk about what's going on in your mind. So with that, you just get an increase in incidence or a recognition of it, and it can seem like it's more people when it's just more people acknowledging. Part of that acknowledgement also can come from even recognizing that you have a problem, because sometimes a person can just not feel good, and just think that everybody's like this and not see it as, well, I actually have a problem. So learning and understanding that, having certain experiences like trouble focusing, trouble sleeping, maybe even like you can't keep food down or have trouble eating, are things that may be a part of the stressors in your life, or there may be external factors that are causing you to feel this way at this time. And like understanding that, and understanding that you can function better brings to the forefront, maybe I have an anxiety problem or a depression problem.
I love how you didn't really bring up like the fight or flight things. I think a lot of times when people think about anxiety and if they're feeling anxious, they think of this state of feeling like in this state of panic. And there's so many signs and symptoms that I think often get overlooked. You mentioned like digestive stuff, you mentioned sleep. What are a few others that you think often get overlooked as far as symptoms of somebody with anxiety?
Oh, it can be things like dizziness, feeling spacey, or like they can't keep their thoughts together, or can't add thoughts together. Like something's is just not clicking. Some people can feel nauseous, even though, let's say, it could just kind of all of a sudden they start feeling nauseous. And they may not associate that with anxiety because you just think, oh, maybe it was something I ate, or I haven't been eating well lately, or something like that. But some people can even wake up feeling nauseous at a time that you would expect, hey, you wake up relaxed. You just slept all night. What's the problem? And because it doesn't make sense that you would wake up nauseous, a person can think that that's not really anxiety, that I have some stomach problem, and end up going back and forth to the doctor and getting lots of tests until they're told, this is probably stress or anxiety.
Speaking of gut health, I know it's like, what is it, 90% of our serotonin is in our gut, 50% of our dopamine. How is things like gut health and anxiety, and worry and fear and stuff like that, how is that all related?
Well, I was just reading an article the other day. I can't remember the headlines, but it was something like eye-catching, like there's more bacterial cells in your body than human cells. It's like we're actually more bacterial and viral than we are human. But what's that speaking to is the fact that there's a whole world of bacteria, virus, fungi in our gut, and those those organisms produce chemicals that then can travel through your body, but straight to your brain through your vagus nerve and have an effect on your emotions and your mind. And similarly, it can work in reverse, where stress and things like that that's going on in your head and body can affect the bacteria in your gut, killing off good bacteria and allowing the bad bacteria, the ones that secrete the toxic chemicals, if you will, to thrive. So addressing the bacteria that live in our gut and trying to make them as diverse as possible, and and making them kind of a healthy colony of bacteria and viruses can improve your overall health, as physical health as well as mental health. And I think this idea of the microbiome they call it that because of the impact that all of these organisms have on our body. It's like a secondary brain in our gut. Some people will consider it a secondary immune system that belongs in the gut. Another way that having bad bacteria can impact your health is when they secrete toxins and chemicals that cause the cells in your gut to separate, and you get a leaky gut and things kind of spilling out into your body. And we create antibodies to these things that can also cause disease. So some things like diabetes and other kinds of things like colitis and things are thought to be due to autoimmunity.
And from a mental health perspective, like based on your viewpoint and your experience on this, like what specifically is it about poor gut health that causes more anxiety in people? Is it that it disrupts like the neurotransmitters that are made in the gut? Is it because of inflammation, like you just said? Like, what do you think is like at the cause of that?
Yeah, it's a combination of things. It's inflammatory based, so it gets a little complicated. But when we use the term inflammation, a lot of people will think of swelling, but that's inflammation can cause swelling, but really the inflammatory process involves the secretion or the production of lots of chemicals in the body that can have a negative effect on cells. That's kind of a general way to think of it. So with poor gut health, you can get chemicals that are secreted by some of these bacteria. They travel through the vagus nerve, which is the longest nerve in the body that goes from your brain to your gut, and travel back to your brain. And one way to think of anxiety when it comes to the impact on the brain is loosening nerve connections, this kind of concept of neuroplasticity. So, for optimal brain functioning, you need nerves to tightly connect to one another, just like any kind of electrical circuit. And so, if you start getting loose connections between these nerves, you start getting inadequate functioning. And so, that inadequate functioning can be responsible for both depression, where you have less serotonin, norepinephrine, dopamine chemicals being produced like they should be. And similarly, you can also get malfunctioning, if you will, of certain structures in the brain that are responsible for controlling or modulating your anxiety. Your amygdala is one such structure that detects threats. And if it is overactive, it can make you think that you need to be fearful about something that's not something you should be fearful about, like worrying about the future or the past, or over anticipating something bad is going to happen.
And I think sometimes people get the feeling of the feeling of anxiousness and having anxiety confused, meaning like if they're going through a stressful situation in their life, it's very normal to feel anxious about that situation. Whereas like anxiety to me means that you're just constantly in that worry mode every single day or for an extended period of time. In your understanding, can you please, I mean, in your understanding, if you could talk about the difference between the two, like how does somebody know that they're just experiencing a feelings of anxiousness versus they actually have like something like generalized anxiety that they should, potentially go see somebody medically to help them with that?
Right. Okay. Great question. Because anxiety is a normal response to a real threat. So if I'm driving and I have to slam on my brake because some ducks kind of fly out into the street, it's going to take me a while to settle down. My heart's going to be racing. I might even feel like I'm going to throw up. That's a normal response. When it becomes an abnormal response is when you have similar feelings of fear, dread, physical symptoms that persist beyond the threat. So let's say in that same example, I pull myself together, I go to the store, I get back home, and I'm still feeling on edge. I have trouble going to sleep at night. The next day, I start worrying about what if that were to happen again. This could have happened to me. Imagine if that had happened to me. So that's just an illustration, but kind of the answer to what's the difference between normal anxiety or a normal anxious response to persistent anxiety that has become a problem is when you have symptoms either mental like worrying or physical like headaches, feeling sick, trouble sleeping that persist in the absence of an identifiable stressor, or even if there is an identifiable stressor like COVID, or maybe your job is going to be reducing its workforce or something like that. It starts to affect your performance, your ability to think and communicate. Maybe you subjectively feel inner distress every day. Like persistence and intensity are really kind of the things that people should look at as to how much is this affecting me.
So I would imagine there's like a lot of gray area in what you just discussed. Like, how can somebody understand whether or not something that they're worried about is like justifiable or whether they're overreacting and they might actually have anxiety?
Yeah, that's a very good point and a good question. So that's going to be determined. Your reaction or response to a stressor is going to be determined by your temperament, your personality. So, what's your threshold for feeling distress about something? That's kind of the question here. Well, how you react in the moment doesn't necessarily speak to whether or not you have a problem because it's all relative. So, yeah, so let's say we have an argument. You are upset in the moment and then you go sit down and watch television. Whereas I'm upset, but I'm screaming, I'm crying, I'm like shaking, I have trouble sleeping that night. So, on the one hand, it might look like I have more of a problem because this really like shook me up and bothered me all day. Whereas you're the healthier person, so to speak, because you were able to just shake it off and go watch television. Well, that's not necessarily the case. Maybe you responded that way because you're fairly guarded and not very emotive or expressive with your emotions. And the stress that caused you shows up in a different way, like you need to throw back a couple of drinks, or you need to go off and do something else that's not very constructive for you to just kind of get rid of this negative feeling. Where the line is kind of drawn between those two reactions as to how much of a problem it causes is how much of a problem does it continue to cause. So now, even though I was really broken up that evening when we had this fight, am I still able to get up and go to work every day? Am I still able to fulfill my duties? Or is this something that I'm fretting about every single day? That would be more the pathological response of how long is it lasting more than how badly did it bother me at the time.
So it seems what you're saying is you can really tell the difference between the feeling of anxiousness versus having anxiety based on how long those feelings persist and how long all of that lasts. And then as far as reducing anxious feelings and reducing anxiety, what do you feel are the best things to reduce anxiety in the short term and then also in the long term?
So there are lots of different things people can do for anxiety, um, making it better and managing it. And what works for one person may not work for the next person. And of course, right now I'm talking about non medication, non treatment options. As far as like increasing your tolerance for anxiety provoking things, some of the things that you can do to just kind of like build up your base or your foundation would be having a clean diet, minimizing processed foods, because the processed foods increase your colony of bad bacteria in your gut. Having regular exercise, like these kind of foundational healthy lifestyle related things are the things that kind of boost up your foundation to better tolerate stressors. And then getting 7 to 9 hours of sleep if you're an adult. Like those are kind of the baseline things. Beyond that, sometimes things like practicing relaxation exercises, whether it be controlling your breaths, deep breathing, because we tend to, when we get anxious, to huff and puff and breathe shallowly. And you don't always recognize it. You don't say, "Oh, I'm breathing shallow right now." You just do it. So taking deeper inhalations and exhalations, slow your breaths so that you're not breathing fast. That's one thing. But sometimes if someone's really anxious, it's hard for them to like stop and do that. Practicing mindfulness, I think, is a very easy and effective thing to do, to kind of center yourself and take yourself out of the stressful moment and focus on what's right in front of you right now. Because sometimes when, especially someone whose anxiety is generated by worrying about future events, that's more the generalized anxiety picture, the what ifing and that sort of thing. Being mindful and paying attention to the current moment with all of your senses breaks that cycle of ruminating about worrying about the future or making something bigger than it may otherwise be because you're not kind of thinking it over and over. Those are just a couple of things. Listening to music is also another way to kind of break the cycle of worrying about something in the future and just focusing in on these pleasant sounds.
I want to stay on the topic of worry because I think that is something that really trips people up where they have an event they're worried about and then that worry turns into more worry, more rumination, and now they're worrying about other things that they weren't even worried about before, and then now it's impacting their relationships, and then they're worrying about that, and it just creates this snowball of unnecessary angst and stress. Let's just say that I was a client of yours and that I was like consistently worrying now about something, whether it be money, whether it be, the health of my dog, whether it be, work tomorrow, whatever it is. Like, what are some best practices, like specifically that could help calm me down in the moment to bring me back to center?
So, one thing I would probably recommend is trying a worry journal. It's where you set aside time for worry because you can't just say, well, stop worrying. That doesn't work. You're going to worry about these things. Okay. But what you don't want to do is worry about it all day or have it running in the background while you're trying to do other things. And it becomes a distraction for you. You can't concentrate, focus, etc. So you're going to set aside 30 minutes or an hour, however long you think you're going to need. And that is the time. It's kind of like compartmentalizing. That is the time that you are going to let it rip about all these things that are bothering you, writing them out, not just keeping them in your head, writing them out. And even during that time, trying to do some problem solving. Because if you have some dedicated time to think through things, just trying to like work through some solutions can be soothing and comforting to a degree, because you can kind of recognize, all right, maybe this isn't the catastrophe that I think that it might become, that there may be lesser forms of this when it pops up, and I might be able to manage this. Because sometimes it's just about control. Will I be able to manage this situation, whatever I'm worrying about? Then you have to have the discipline to allow yourself, or to say to yourself when something pops up, I'm not going to think about this right now, because at 7 o'clock, I'm going to be able to just let this roll. If you still have trouble shutting it off, then maybe make a quick note to yourself, in your notes app on your phone or something, about this thing that you are going to later fully explore. That does take work to be able to stop. One thing that some people can use, it's a grounding technique in some ways, to make themselves stop thinking about something that they're going to think about later, is wearing like a rubber band or some other kind of elastic thing around your wrist and snapping it when you find yourself slipping into these thoughts, or spending too much time thinking about this thing that you're supposed to be worrying about later.
That's a great process, and I love how you like laid that out, like giving people like practical tools to process their worry, to help them move through that situation so that it doesn't become worse. I want to shift gears just a little bit and talk about ADHD, talk about attention, because I know right now a lot of people are struggling to pay attention. Our attention spans, I think, are decreasing and increasing over time based on the world that we live in. But I think people often will say, well, I just have ADD, I just have ADHD. Based on what you know, what's the difference between somebody who has something like ADHD versus somebody who just needs to just do a better job at, like, paying attention, and needs to do a better job at just staying focused on tasks and not getting distracted?
So ADHD is one of those diagnoses in psychiatry that it's a double-edged sword, because the people who really have it, it's a real problem, bigger than I think people appreciate. But yet, some of the symptoms are common enough that it's easy for people to think they have a disorder when they just have trouble focusing for the moment, or even for this season of time that they're in, because they're juggling too many things. Not every inability to focus or follow through on things is the disorder of ADHD. So what happens is everybody can get mixed into this one big pie, and then the people who do have a disorder get marginalized because of a sentiment of, well, everybody's got ADHD. So, what's the problem? All right, that's my my own personal frustration with dealing with this disorder, because I will have some people come and want to get put on medication because they've been, doing well in sales all these years, but now, the younger people are doing better, so they want to do better at 55, and so they want pills to help for performance enhancement. That is not the way to address that problem. But at any rate, I will say, and it's easy to get me going off on a tangent with ADHD, because it's a very hard disorder to manage or deal with for the person who really struggles with more than just attention, but executive dysfunction. What does executive dysfunction look like? Poor planning, poor time management, even emotional dysregulation can be a part of ADHD. It's not part of the diagnostic criteria, but it's an associated symptom. ADHD can affect the way people think about themselves and their self-esteem. Because if you think about it, some of these things, with always like being late all the time, be exasperating for the people around them, and those people can then not want to deal with them. think that you're just lazy, think that you're not very smart, and it can really take a toll on your self-esteem. As usual, I've lost track of your question because I have a lot of unvented feelings about this disorder because I've seen the pain of people who are struggling with it. And especially now with medication shortages out there, it's very frustrating. And and these medications don't always, they can have their own negative effects. I was just talking with someone today about the crash effect of Adderall, taking it, being able to focus well for several hours, and then feeling this kind of crash and burn effect afterwards. And that makes them not want to take it.
So what I'm hearing you say is somebody who has ADHD, how you can tell the difference between that and somebody who just struggles to pay attention. It's more about how they operate and function in their daily life. Like, are they good at planning? Are they good at managing their emotions? Are they good at being on time to things and scheduling? And it's not just somebody who can't focus on a task for a period of time. Like, it's somebody who actually is challenged to manage their day-to-day life, correct?
Yes, that is part of it. And thanks for help redirecting me back to your original question of how you can tell the difference. So that is a big aspect of it. It's more than just inattention. But there are so it's kind of also a diagnosis of ruling out other problems. So anxiety can make people have trouble paying attention. Depression can make people have trouble paying attention and focusing. So, someone who starts noticing that at 45, you're having trouble focusing, it would be important to look at, are there other medical issues going on? Low thyroid production can affect how you think and problem solve and things like that. Being under a lot of stress, as I mentioned, can make it hard for you to focus and get things done. So when you're looking at, is this really ADHD that no one has recognized up until this point? You'd look back at your childhood, because it doesn't start in adulthood. It really starts in childhood, but people may go through childhood managing until they get to a point where they've got too many responsibilities to be able to manage, and then they start noticing these problems. But generally, they would have a history of having some degree of either hyperactivity or trouble organizing, focusing, concentrating, even in childhood. But now, as an adult, it may be worse.
And so you talked about some of the dangers with taking medications and that they're not as readily available as they used to be. From a lifestyle perspective, how can somebody begin to reverse some of these symptoms of ADHD?
They're not easily reversible. So I will say with ADHD, it also can be a threshold issue, meaning that you've got symptoms that aren't that bad, but they're manageable up until a point where something makes it not that manageable. So what do I mean by that? So let's say you have trouble, your ADHD or your attention issues mostly manifest with you read slow. Sometimes you don't remember what someone said to you because you weren't paying attention, things like that. But hey, you do fine working as a graphic designer. When you've got your assignments, you don't have to talk to people, and you just do your work, put your head down, and you can do it because it interests you and you can stay focused. But your job shifts, and now you've got to do a bunch of meetings, and that doesn't work for you now. You can't pay attention and things like that. So now things start to slip. Well, the example I'm using here is to illustrate that if you recognize your weaknesses, like you can't focus on talking, but you can read, then you want to stay away from jobs, or try to the best that you can control. Stay away from things that stretch your abilities too much, or rely too much on your weaknesses, and focus on things that lean to your strengths. So I want to pursue a job that doesn't require me to have to do tons of reading because I'm not a good reader, as an example. So I go more toward a job that doesn't have that. So like with the planning, for example, if you've got some assignments, keeping calendars or lists. I mean, not all of these strategies work for everyone, but keeping pieces of paper is probably not a good idea. Do you work better with a planner? But like planning out like your goals and having smaller steps in between, step one and the ultimate goal, things like that. And how you do that just kind of depends on what works well for you.
You talked about it from a vocational perspective and really making sure that if somebody thinks they have or they've been diagnosed with ADHD, doing their best to make sure that they stick to kind of whatever they're good at when it comes to profession. I know that it can be quite different though if you're like at home and let's just say you're married, you're in a relationship, you have kids, and it's not as easy to say, well, I don't like talking, so I'm just not going to talk to my spouse or I'm not going to talk to my kids. What are some ways that you've seen to be effective, either with some of your clients or just through your own research, for people to work on their ADHD in their home life?
I think the things that have the biggest impact with the relationships are listening and interacting with people and time management. I think those are kind of the biggies that can be sore points if you're always late, not following through with things that you said that you were going to follow through with, doing what you need to do to keep up with your time, whether it be having alarms, multiple reminders. And this may sound like, oh, that's just so basic, but you'd be surprised at how many people have trouble keeping up with time and don't even wear a watch or don't do anything to keep up with their time. One exercise that I've used with some patients is going through typical things that they do during the day and seeing how long things take for them, because a common problem is underestimating how long things will actually take. So I've got a party, I'm supposed to show up at 2:00. It takes me 30 minutes to get there, and I start getting ready at 1, not remembering that it actually takes me an hour to do all the things to get ready. The person with ADHD may not appreciate that it actually takes an hour. Even though they've been getting ready for years, they still don't have it down in their head that this actually takes an hour. So knowing how long things take, being able to better plan out your activities and leaving enough margin and room for wiggle room, I think can go a long way in not creating a lot of friction because you're late or you can't deliver something when you're supposed to. And then on the other aspect of the communication, listen in a way as if you had to transcribe what the person is saying. Don't be thinking about what you want to say next, because then that comes across as, you weren't even listening to me. So I tell you something that happened to me today, and then you ask, so where'd you go? I'm like, I just told you. I know you weren't listening. So trying to rein in the mind wandering and things while people are talking to you and listen as though you had to like repeat everything that I said to someone else, like listening with a lot of intention.
What's your advice for somebody that, let's just say somebody who's listening to this has ADHD, or their spouse or somebody that they're in a relationship with has ADHD? What's your advice for them to navigate the growth for that, so that the person who has ADHD is able to like effectively communicate with their partner, like, hey, I'm working on this, please be patient with me, I'm doing the best I can. And then also from the other side, that I'm sure it can be frustrating at times if you're in a relationship with somebody that's always late, doesn't know can't plan anything, can't follow through. How can that person also learn to have some compassion for what this person's going through while supporting them on that journey?
That requires a lot of effort on both sides, just kind of how you laid it out there. I think it starts with the person with ADHD recognizing that the problem, the things that they have difficulty with cause frustration for other people. Now, it probably causes frustration for them too. It's not fun having to always look for something and never finding things and, all of that. But still, being willing, you have to start with being willing to make changes or do things to improve these things, so that it's not such a burden on the other person. Because if you don't, like if you just say, well, this is the way I am, and if you love me, you'll deal with it, that's not going to work. Because then the other person doesn't feel like, well, if you loved me, you try and improve this. So then on the other side, for the other person who's not affected with ADHD, it's kind of two things, two approaches. One is if your partner or loved one is working on this, so they've started there, then is trying to extend the patience to understand, to stay top of mind that this is a problem that they have, a neurodevelopmental problem. This is not just being lazy or inconsiderate, and having that takes constant reminding, because if you don't think that way, you don't understand. You can't understand how someone can't remember to put the toothpaste back in the drawer, or put the top back on, things like that. But then another angle to this support person is not turning into a parent if it's a partner, or becoming the mommy, if it's a woman and a husband who's assuming the role of a surrogate brain and taking care of everything. And it's hard not to slip into that if you want to just kind of be the one who takes care of everything in the family, because your partner is going to forget. So I know that. So I'll just do it myself. But then, the dynamics can end up being that the non-ADHD partner becomes more like the parent or someone that they shouldn't be, instead of being an equal. We're still peers.
I think from what I'm hearing you say, it just comes down to communication, learning, growing, compassion, and also accountability for that situation. It's going to help each other grow throughout that process. I want to go into something else that I think a lot of people are having a hard time with right now, and that's depression. I guess, like, based on what you know in your education and the growth of research that's come out about depression, like, what are the telltale signs and symptoms of somebody who's experiencing depression?
Probably the most obvious, or the one that people could probably relate to most, is a person who's sad, not very, or glum, crying, things like that. But that's not always the way depression looks. So, and also one day of crying doesn't have to mean depressed. So these would be, the diagnosis is that you have these symptoms for at least 2 weeks. And that's to take out, having a bad day kind of thing being a problem. That said, depression can carry with it a lot of physical issues as well, like energy, very low energy, trouble getting out of the bed. So you see someone who's like lying around all the time, it's hard to stay in the bed for hours, unstimulated, if you're not depressed, or be sitting around in a room with no television, you're not doing anything, and it's hard to sit there unstimulated. Sounding as though you're hopeless, like you just don't see, being very negative all the time. Lots of sighing, because everything's hard, everything becomes hard. Having low frustration tolerance, we call it, of not, we've got to, call the plumber today, and this happened and this happened. Well, the person who's not depressed, that still might be frustrating to have all these things on the to-do list, but the depressed person may just feel so overwhelmed with all of that they end up doing nothing. So things are just kind of piling up around them. Maybe their home is in a big disarray, or their room, because they just can't pull it together to organize anything. Those are kind of more subtle signs of depression. And irritability is another subtle sign of depression.
I think sometimes the doom and gloom and how you feel mentally and emotionally can be so overwhelming when you're in the thick of depression that people have a hard time like taking that first step out, and then like feeling sometimes depressed for a few weeks can turn into a few months, a few years, and so on and so on. What has been effective with your patients and people that you've seen when they're in the thick of a depressive state to be able to help them take some small steps to get out into a more positive one?
Sure. So, medication aside, an intervention for depression actually is called behavioral activation, and that sounds nice and clinical, but all it really is getting moving little bit by little bit. The more you do, the better you feel. And typically, with a person who's really depressed, even just getting out of the bed can feel monumental. And they can end up spending most of their day not doing very much, even if they thought they were doing something. It's like if you watch them, they're not doing anything hardly. Everything's slow moving. So that said, if you can't take a person who's barely getting out of the bed and say, "Well, go to the gym 5 days a week and get on the treadmill for 30 minutes." They're not going to be able to do that. Just so you take it in baby steps. So take a walk around the block, or just things that are easy. And it doesn't even have to necessarily be athletic. It could be get up and go to the grocery store and come back home. Things that they weren't doing, to start doing little things and then take it from there. After you're able to get up and go to the grocery store, then now go to an appointment or go to a friend's house and then come back home. So increasing activity and increasing contact with people have been things that have helped people who are depressed and isolated.
Yeah, I love that you brought up taking the small steps, because I think sometimes people, they try to go from 0 to 100, which is incredibly overwhelming. Like, you wouldn't tell somebody who has never run a mile to go out and run a marathon, right? It's like kind of the same thing with somebody who's in a state like we've been talking about. I think it's really effective to just start them slow, and like you said, have them walk around the block and take that first step, and then start to build off of that. From my own experience and of having my own struggles with depression in my past, I've had a hard time with like negative thoughts, and I think a lot of people do as well. That when they're in that depressed state, sometimes what keeps them stuck is how they feel about themselves or how they feel about that situation. How can somebody begin to like transform those negative thoughts into some sort of positive action?
So this is where therapy comes in to help. Now, granted, everyone can't afford therapy, or either they don't have the resources for it, or there may be like no one taking patients in your area. That's a thing these days. So in the absence of, say, professional help, sometimes, if you are not that self-aware, you could still get the assistance of a friend, someone you trust, to help you recognize negative thinking that you have. Because when you're depressed, you may not even just have the mental resources to self-reflect enough to recognize negative thinking. So it would take some kind of exercise, whether it's something that you read and someone's prompting you, or a friend prompting you. So, hey, you wanna do this? Well, no, because I just don't think that blah, blah, blah. And that friend helping you see, hey, what do you mean that you don't think that anybody will like what you did? I like what you did. Why would you think that? That's one way a friend or just someone hearing what you're saying and mirroring it back to you, repeating it back to you, helps you see your negative thoughts. And then the next step beyond that would be trying to challenge the thought that you have, because chances are there's some distortion in what you're thinking. It's interesting you bring this up now. Mentalhealthamerica.org has a lot of good resources on their site. And they have even more now that Mental Health Awareness Month is the month of May. But they have an exercise on their site that is, I forgot what they called it, but it's a cognitive distortion tool. And you can put in something that you think, and it can help you recognize how it is a thinking trap. Is it catastrophizing? Is it overgeneralizing? These are some examples of cognitive distortions that people can have that affect how you think about yourself. Then once it helps you recognize that, then it even gives you suggestions on how to reframe what you think. I bring that up because it's a self-help tool, but that's the kind of thing that it would take for someone who can't do their own self-reflection, of having someone try and kind of pull out some of these thinking traps or negative thoughts that they have and help them reframe them.
I love that. It seems like a great resource, and I'll be sure to include the link to that in the show notes. I want to talk about from a broader perspective, what are some things that people can do to optimize their mood? Like, for instance, I know that if I'm trying to coach somebody to eat healthy, I'm like, all right, half your plate in vegetables, get some lean protein, get some healthy fat, get a good source of carbohydrates. Like, what are the things that you would include on somebody's plate if they're looking to optimize their mood?
I think diet is everything. And so in addition to eliminating highly processed foods, so packaged goods, people will often say shop the perimeter of the grocery store and not the interior of the grocery store where you have all the packaged stuff. Eating about half of your plate be vegetables, and yes, having some healthy fats. Now, there's this whole thing of plant-based diets. I happen to be a person who believes in plant predominant because there have been there's lots of support for the Mediterranean diet being an actual treatment for depression. There was a study where part of the control group had what would be like the sham therapy and a non-Mediterranean diet, and then the control group had a Mediterranean diet, and the Mediterranean diet group of people improved in significant areas with their depression symptoms. The Mediterranean diet includes meat, so it's still heavy fruits and vegetables, but it includes meat. You want to minimize the meat, so you don't have a meat meal every single day, but it does include meat. So that's why I say plant predominant. But I think kind of easy steps for someone would be to start with probably adding an additional vegetable to their meal every day. Because, if you think of a typical meal, a meat, a starch, and a vegetable, well, add another vegetable in and have less of the starch, say. Or if you don't like meat, have another vegetable instead of meat. But having nutrient-dense meals is like fertilizing your brain. That's what we need. We need nutrients.
Absolutely. The way you eat is so important. And like, other than like diet and trying to follow a healthy dietary pattern, what are a few other things that you think people should be doing on a daily or weekly basis to optimize their mood and help prevent depressive states?
So that would also include at least, we generally say 150 minutes of aerobic type exercise, which works out to about 5 days a week, 30 minutes a day of some type of cardiovascular activity. So that could be brisk walking. It could be, doesn't have to be running. So regular exercise, and that's what's considered regular exercise. Instead of 150 minutes, it could be 75 minutes of moderate to high intensity exercise. That would be more like jogging or running or swimming. So, regular exercise, as clean of a diet as you can get, which then means, I mean, that's work, actually. That's actually saying a lot to have a clean diet. You're probably having to bring lunches, fast food doesn't cut it. And then planning your day around sleep. I've always said that I think sleep planning starts in the morning and not at nighttime because what you do during the day matters. So if you have this really high stress day, let's say you go working out at 8 p.m. and you're trying to go to bed at 11, your body's probably going to be too overheated or too warm to be able to fall asleep a couple of hours after you worked out. You need some distance between exercise and going to bed. So planning your sleep in the morning means setting a bedtime, which a lot of people don't set a bedtime. They just go to bed whenever it works out. But setting an actual bedtime and then working backwards as to what you should and shouldn't be doing before bed. I usually recommend people not have any caffeine after noon. Different people metabolize caffeine differently. Some people faster and some people slower. But a good rule of thumb is just don't have any caffeine after noon. I usually recommend people not have anything to drink at least an hour before bed. Sometimes that's hard for people. They don't like going to bed feeling thirsty. But if you drink too close to bedtime, then you're going to wake up needing to go to the restroom before your body's ready to wake up or your mind is ready to wake up. So sleep is huge, and it takes discipline and effort and intention to make yourself get into a regular sleep routine.
Yeah, I mean, I think if people could just master how they eat, exercise, and their sleep, it will get them such a long way with improving their mental health or any other area of their life. The last thing I want to ask you about is procrastination. And obviously, if somebody's struggling with anxiety, ADHD, or depression, like that is likely, I'm sure, contributing to the procrastination. But for somebody who maybe isn't experiencing symptoms of those three things, what could be their process to stop procrastinating and actually do the thing that they know they should be doing?
One suggestion is to pair the thing that they have to do with a reward. I have a paper that I've got to write and turn in. Hate writing. So I'm going to put, instead of putting it off until forever, one, chop up the task to make it into something that's easier for me to handle, like trying to plan out, I'll write, if a 10-page paper, I'll try and write 2 pages a day or something like that. I'm just kind of speaking off the top of my head. But then when I am, and then even with that, those steps, I could pair those steps with the reward. So after I complete 2 pages, then I will allow myself to be on TikTok for 30 minutes. And then when I get to 80% of this task, then I'll allow myself to go and, meet a friend for a drink or socialize or something. That's one suggestion of how to get past procrastination, is to jump in head first and do the unpleasant, knowing that you're going to have something pleasant follow it soon afterwards. And so that you can look forward to the other thing and just kind of get through the thing you don't really want to do.
Right. Positive reinforcement definitely works. Do you believe in like scare tactics? Like, do you think that thinking about like where your life could be if you don't do that thing actually is effective?
Sadly, I don't. I mean, I do think that can motivate some people of like, ooh, I don't want to be broke, so I'm going to build this business. Okay, I think the person who responds to that isn't the person we're talking about with this ADHD, procrastination, and all that, because that's the thing. I know we were talking about anxiety as well, but that's the thing with ADHD. It is not just mind over matter, just make yourself see the future and you'll be able to pull through. But yes, some people can be motivated sufficiently by just looking at like negative reinforcements, looking at the things they don't want to happen. And then there are always the people who'll say, well, I work better under pressure. Those are people who can't have too much fluff out at the beginning. Like if there's just too much space out here before the deadline, that distracts them. Like that extra time is distracting and they fill it up with something else until they get close enough to the finish line to see the finish line. And then that's what pushes them forward to walk through the finish line. But if the finish line is way too far out in the future, it doesn't mean anything to them.
Gotcha. Yeah, that all makes sense. And I think this is a great place for us to kind of end our convo because we've covered so much ground, and I think the audience is really going to appreciate it. So, Tracey, I wanted to really thank you once again for your time and for coming on. If people want to learn more about your work, if they want to follow you on social media, where's the best place to do that?
My main place that I am on social media is YouTube. My YouTube channel is my name, Dr. Tracey Marks, and that's DR, and then Tracey, Tracey, Marks, Marks. I'm also on Instagram and TikTok at the same handle, Dr. Tracey Marks. And then my newest invention is the mental wellness space. It's mentalwellnessspace.com. And that's where actually we address mental wellness from the perspective of diet, exercise, maintaining healthy lifestyle choices and things to optimize your mental health.
That's so amazing. And I'm so glad that you are tackling mental health from a wellness perspective. I think it's so needed. So, Tracey, I wanted to once again thank you for your time. I will be sure to include the links to your stuff in the show notes. And for those listening, what I invite you to do is to share a takeaway. We covered so much ground on ADHD, depression, anxiety, procrastination. What I want you to do is to share a takeaway of what resonated with you the most and tag Tracey and tag myself because we'd love to hear your feedback. We once again thank you for listening to this episode of The Adversity Advantage. I'm your host, Doug Bopst, and we'll see you next time.